Okay, how did you got into the anesthesia training program? Was it difficult? What was the training like?
All right, it's very, very difficult because obviously it's very, very competitive. So how they sort of benchmark candidates is obviously based on you getting the 3 month rotation as an RMO in your second year or your third year. Some MOs are not lucky enough to get that 3 months in anesthesia, so you don't get that hands-on experience or that visibility from the consultants for them to know that you're interested. Going back to how hard is it to apply for training is very, very difficult. So it's all state-based application. So obviously there's South Australia, Western Australia, etc. And they go based on your CV or whether you've done any rotations in anesthesia, whether you've had any experience as a service registrar. And the interview is obviously you can apply. And I only got a chance at an interview on my fourth attempt. So you can see how difficult it is. But the main bit is you need to get that rotation as a MO, and that is your stepping stone to getting your crit care year, etc. Like what happened to me.
So if you don't get that rotation, you cannot apply. Is that what it is?
No, so there's no point applying because your chances are like you 0 to none. Because you have after your housemanship, you need to write a cover letter to the director of anesthesia or ICU to get that 3 month rotation where there would only be 8 spots. So think of it as 4 rotations as an MO, one hospital. If you're covering 2 hospitals, means there's 8 spots. So if it's one hospital, it's 4 spots, means only 4 candidates will get that spot for that year for that 3 months. So if it's 4 different rotations, then that's 12 spots per se, or 16 spots. So it is very, very difficult.
So do you
And
have
it's,
to apply every year?
yeah, Australia is every year as an MO, you have to apply. So you have to apply and do the interview. I mean, it's quite straightforward. You will get the position again. But that is where you sort of decide, all right, after your first year of housemanship, you do your interview to be an MO. And then after that, you apply every year. And then if you want to get a surgical year or if you want to get ED year or you want to get an ICU year, then that is based on how your first year is and how your consultants look at you, etc. So
So you
my,
attempted
right?
you attempted to get in for 4 years.
So I attempted to get in for 3 years. So after my first rotation as an MO, towards the end of my second year as an MO, I tried to apply and I was declined. And then I was lucky enough in my third year to get a crit care year. So a crit care year where my director said, all right, it's half anesthesia, half ED. So where during ED, I was like the airway person. And then obviously that full year of purely anesthesia and ED gave me a stronger chance to apply. And even in that year, during my anesthesia rotation, I'm applying because there's 2 attempts a year to the program. So I didn't get in. So there's 1, 2, 3 attempts I didn't get in.
So
So
how many
yeah.
people